Patients are reaching out to OHSU for a variety of reasons. A lot of times they've heard something on the news, or a friend told them about it, or their loved one. I had a patient's husband read an article and say, "You need to call OHSU." My name is Larsen. I'm a registered nurse. I've worked primarily within the neurosurgery department, mostly at the bedside in the last 20 years, and now I've moved here to the focused ultrasound. I am the patient coordinator. When I talk to patients about their journey, I hear a lot of common things. It's heartbreaking. They can no longer do the things that they used to be able to do. Even basic cares of their own body. They cannot feed themselves. They cannot brush their own teeth. They're making a mess. They can't take care of their grandchildren or their pets. They can no longer do the hobbies, the things that they loved. Sometimes patients are still in their careers and they're starting to have impact in their careers. They can no longer write if they're a writer. They can no longer type when they have typing that they need to do. After speaking with patients who've undergone many changes to their medication and having side effects that are just intolerable to their life, it is such a great opportunity to be able to offer them focused ultrasound. We are accepting patients from all walks of life and from all corners of Oregon and the greater USA. We are the only facility in the state of Oregon who's offering focused ultrasound. To qualify for focused ultrasound, our patients need to have tried and failed at least one medication. That medication could have been prescribed by a neurologist or their primary care physician, and a side effect can be anything from sleepiness or to just intolerable side effects. If they're not able to tolerate the medication for a long-term use, we consider that a trial and a fail. My role on the day of the procedure is that I am one-on-one with the patient through the entire day. I will be there to greet you when you arrive. I'll be there in the prep room as you're getting ready with your IV, your medications, and getting your hair shaved. I'm making sure that if you're having any pain or discomfort, that is being addressed immediately. I would have to say every single patient that I've seen with a bald head looks so good with a bald head. Not a single patient looks bad with a bald head. Some patients have had their tremors for just a few years, and some patients have had them their entire lives, 50, 60, 70 years. And I'm so glad that we have this option to be able to offer them focused ultrasound at this time now. Every patient has the thing that they love, and if they're able to return to even part of it, it brings a lot of joy into their life. The option for focused ultrasound is a real option to have their tremor relieved and to be able to go back to their normal lives, but without having to have the side effects of medication every day. And once the final treatment is done, we can see the patient's arm stop tremoring. And it's an incredible moment. We all cry. I cry at every procedure because it's just an amazing result.